ಬಟನ್ ಚೇಂಜ್ ಮಾಡಿ ನೆಕ್ಸ್ಟ್ ತೋರಿಸ್ತೀನಿ ನಾನು. ಹಲೋ, yeah, it has come, it has come, shall I start? Okay. Yeah, so we'll start start discussing about endometriosis. Endometriosis means it is basically the presence of endometrium, normal endometrium, which is supposed to be in the uterine cavity, is being situated in an abnormal site. So it's only the presence of endometrium in abnormal site we call the condition as endometriosis. It is a very important clinical challenging situation because here patient has got a severe degree of pain where she comes for treatment, and it is very difficult to diagnose many times, and even it is maybe the cause for infertility also. Okay, we will go into the full detailed aspects of endometriosis. So I welcome all of you for the class. So I'll be going in detail about endometriosis. You can follow, right? Next. So it is very important to identify the symptoms and consequences as with respect to endometriosis, associated with endometriosis, and we shall be discussing the various treatment options in the management of endometriosis also. Okay. Next. So by definition, what is endometriosis? Endometriosis is defined as a disease in which the endometrial glands and stroma implant and grow in the areas outside the uterus or uterine cavity. Most commonly, implants are found in the pelvis. Lesions may occur also in the distant sites like, of course, pleural cavity, liver, kidney, gluteal muscles, of course, bladder, spleen, even in scar sites, which you call as scar endometriosis, of course, is also possible. Okay, and even bladder, urinary bladder may harbor sometimes endometriosis. Next, what are the features of endometriosis? Endometriosis varies in a very wide prevalence of 2 to 50% of the women, 21 to 47% of patients who come for infertility, and even recently we are witnessing even as high as 60% of the patients with infertility are having endometriosis. Okay, exposure to ovarian hormones appears to be the most commonest and important cause, and known racial, no much of racial and socio-economic predilection. Of course, will be a disease found sometimes in high affluent societies, especially associated with obesity, so-called hyperesthetogenic status, but not necessarily always obesity. Even thin women can have endometriosis. Severe disease may run in, of course, in families. So, next. Hey, in the code. Yes. No, one side in the code. Is it endometriosis is increasing in incidence? Obviously, yes. Mainly because of the diagnostic modalities, endometriosis is really increasing in incidence. In 1965 to 1984, endometriosis rose from 10 to 19% as primary indication for hysterectomy. Simultaneously, a trend of more conservative therapies were coming up, which suggested to increase in incidence. And theories include delayed childbearing, longer exposure to estrogens, less use of oral contraceptives, and exposure to environmental toxins such as dioxin or hyperestrogenic status. Next. So, what are the etiologies or what are the reasons or what is called as etiology of endometriosis and the pathophysiology of endometriosis? Of course, we don't have an exact etiology what actually causes endometriosis. It runs because various theories have been put forward to explain endometriosis. One is the retrograde theory of Sampson, where the menses move backwards into the peritoneal cavity and causing peritoneal implantation, and most women retrograde menstruation is also seen. And Mayer's theory of coelomic metaplasia, the second type of theory that they try to explain endometriosis, and it's got a low incidence of plural disease explanation, of course. Halban's theory, hematogenous or lymphatic spread to distant metastasis, and doesn't explain why gravity-dependent disease sites are seen. Immunological maladaptation or immunological defects is also another theory which is trying to explain the etiopathophysiciology of endometriosis. Next. So this is how we can see, very classically the yellowish spots, blackish spots, which are seen in the pouch of Douglas very classically. And sometimes the ovary on fallopian tubes and peritoneal surface you can see, and in the site of uterosacral ligaments, and sometimes coming to the anterior bladder also you can see these deposits. Of course, we will show you the pictures. This is of course a picture of normal pelvic structures. You can see the uterus, a pouch of Douglas, and anteriorly the vesico-uterine fold of peritoneum. So I will be going to next pictures with endometriosis. So can you see here typically a puckered area is there which is whitish and scarring is seen. These are a typical lesion of endometriosis can be seen. Next. This is also the typical other lesion, endometriosis of the uterosacral ligaments. Next. See, this is how you can see. This is a chronic endometriosis where there is a puckered area of uterosacral ligaments. Yeah. So based on the type of spread that is involved, you can classify, particularly the American Fertility Society has classified endometriosis into stage 1, otherwise called as minimal endometriosis, stage 2 mild endometriosis, stage 3 moderate endometriosis, and stage 4 is severe endometriosis. And the score is of course 4, 9 and 29 and above is severe endometriosis, and 114. You can see the score. So this is called as AFS scoring system with respect to endometriosis. So what is the clinical presentation of endometriosis? The most important clinical presentation is the pain. So pelvic pain, lower abdominal pain is the most important symptom in endometriosis, and some of the patients do present of course with infertility, and mass per pelvis can also be seen. Next. Now regarding the pain, the classical type of pain you see in endometriosis, we call it as triple dysmenorrhea. So the pain is of course very cyclical, variable in length prior to and after menses, and during menses also of course, which you call as triple dysmenorrhea. And acyclical, constant, dull-aching pain which is unrelenting and it is always there, can also be seen in some patients. And associated activities will include dyspareunia, dysuria, dysgesia, of course. Other sites of pain include the muscle regions and distinct tissues, and especially sites of scar. So infertility is again another very important symptom in endometriosis. It is of course a moderate or severe disease of endometriosis, where you can see the erections, distortion of the normal anatomy of the pelvis, pelvic sperm egg interaction. There is a prevention of sperm egg interaction, and minimal to mild disease. You can see infertility, and the exact mechanisms, of course, even though not known, but they are well understood pathophysiology that will lead to endometriosis. Basically, it interferes with altered physiology and destruction of the gametes, and altered anatomy, altered physiology can be the cause for infertility and endometriosis. And the physical findings include the tender nodules along the intersacral ligaments or in the cul-de-sac, especially just before menses. By pervasive examination, you can see, and pain or induration without nodules commonly in the cul-de-sac or retrovaginal septum. Uterine or adnexal fixation or adnexal mass can be seen. Previous in the next. How do you diagnose endometriosis? Direct observation of implants laparoscopically, conscious pain mapping, imaging of endometriomas, and MRI, maybe the investigation of ties, especially to detect lesions of 3 mm implants, ultrasound helpful in office settings, and biochemical markers sometimes not much useful, but still CA125 can be done of endometriosis also, of course. So, I mean class, pathology. Next. So, endometriosis, of course, initially may look asymptomatic, but later then progressively it involves the nerves also, where it leads to chronic dull-aching pain, and it is really troublesome, and this pain is very severe and intolerable, and women ask for repeated treatment, and the pain not subsiding even after 6 months after analgesics and antibiotics and full efficient treatment. We call it as chronic pelvic pain. And chronic pelvic pain, one of the very important etiology is endometriosis. So you can see the lesion there, of course. Next. So characteristically in ultrasound or MRI, you can see accumulation of blood in a cyst-like manner, especially in the ovary. We call it as endometrioma. Okay. In endometrioma, as you can see classically, this is the endometrioma, which can give really a troublesome chronic pelvic pain, and also it also interferes with what is called as ovulation, leading to infertility. Next. So coming to treatment of endometriosis, of course, it is the management of the symptom is the most important in endometriosis. Particularly, pain is the predominant symptom, and that is the one. So she may be requiring surgery or medical therapy. And if the patient is infertile, it is very important to do an infertility surgery or a reconstructive surgery for that patient. And sometimes they do have ovulation induction disorder. Obviously, requires ovulation induction with maybe gonadal citrate or gonadotropins or GnRH or NOx, etc. And long-term protocols of GnRH may be preferred in these patients of endometriosis. And maybe some patients requiring ERT, of course, assisted reproductive technology in the form of ICSI or what do you call IVF may be required. Okay. So coming to the management of pain in endometriosis, it is the surgical treatment versus medical treatment is the one is always being really debated for. The surgical treatment include ablation of the endometrial implants, lysis of the adhesions, ablation of the empty sac nerves, which is called as LUNA, laparoscopic uterine nerve ablation, and resection of the endometriomas. Combined surgical and medical treatment may also be preferred in some patients. Next. So you can see endometriosis sitting in the bladder, of course, here, and in the rectovitreal septum. Next. See, they are trying to remove the excision of the endometriosis on the superior surface of the bladder. This is the excision of the lesions with the laparoscopic scissors, of course. Next. So you can see the chocolate cyst of the ovary, the chocolate-like material which is dark. You can see the dark material there, which is coming out by incision on the ovary. So they are trying to remove, and trying to reconstruct the ovarian anatomy. Next. So treatment of pain, medical management, you can still prefer to use oral contraceptives, progestins, danazol, GnRH agonists with advent therapy, of course, alternating GnRH agonists and oral contraceptives, and sometimes aromatase inhibitors can also be helpful. So basically, what is the what is the principle of managing endometriosis is you must see that the cut down the estrogen action on the endometrium. So basically, these drugs they either suppress the ovary, making the endogenous estrogen present, or giving progesterone is another alternative. Okay. Next. So estrogen is the main hormone which is the culprit for endometriosis. So for it, it has to be suppressed or give drugs which cause anti-estrogen. So you can see the estrogen drugs which acts to prevent the estrogen action. So aromatase inhibitors, can also be tried. So these are the group of drugs: aromatase inhibitors, etrozole, anastrozole, danazole. All this will be tried. So basically, the treatment of, if you look at the patient with infertility, when is the cause for endometriosis. So removal of the disease, reconstruct the anatomy to near normal. Surgery improves the conception rates in these patients with this surgery. Ovulation induction may be required in patients, in some patients where you may prefer to use gonadotropins with ovarian suppression, or IUI can be done, or sometimes when you have to use gonadotropins, particularly FSH and LH. And medical suppression of the ovarian function may not be that of much benefit, of course. And assisted ERT may be preferred in some of the patients, assisted reproductive technology. Next. Ashtad. Okay, with this we will be completing the discussion on endometriosis. If you got any doubts, whenever you come for the reporting the class, please write it down. We can come and meet me personally. We can start discussing in detail also, of course. Okay? Or if you get any doubts, you can text my personal number. Okay?